Hi, Patricia here from Rapid NCLEX. Still on the topics you should know for your NCLEX exam. Today we are talking about peripheral artery disease. So peripheral artery disease is a condition in which there is inadequate blood flow to the extremities, meaning blood is having a hard time getting to the legs. Take note for your NCLEX exam that this is different from peripheral venous disease. So in peripheral venous disease, blood has no problem getting to the extremities, but rather it has problem getting back up to the heart. We'll be talking more about peripheral venous disease in our next video. But for now, let's talk about peripheral artery disease. The main cause of peripheral artery disease is atherosclerosis. We talk of atherosclerosis as a condition in which there is buildup of plaque within the arteries. So atherosclerosis is going to partially or completely occlude the blood vessel, which is going to impede blood flow down into the extremity and deprive the extremity of the oxygen and nutrients that they need. So to our risk factors of peripheral artery disease, hypertension is one of them, diabetes, obesity, hyperlipidemia. So for hyperlipidemia, we've been talking about in our previous videos. So starting with total cholesterol, we said it should be less than 200. Triglycerides should be less than 150. Low density lipoprotein should be less than 100. And high density lipoprotein, which is the good cholesterol, should be above 50. And to the signs and symptoms. So take note for your NCLEX exam. The key signs and symptom here is intermittent claudication, meaning that patient is going to have severe or worse pain during walking or any activity, and they feel better when they dangle the legs in the dependent position. Other signs and symptoms include late capillary refill time. So when you do a capillary refill for them, it's going to be delayed, meaning that the normal should be 2, but then theirs is going to be delayed. And then there's going to be decrease in pedal pulses, and then lack of hair on the skin area, which is also going to be shiny. There's also going to be pallor on elevation of the legs. They also have rubor or red in the dependent position. So when their legs are in the dependent position, you are going to see it to be rubor or red in color. They also have dry necrotic wounds on the extremities, and they have delayed wound healing due to lack of oxygen and nutrients to the extremities. And to the diagnosis, the main diagnosis here we can do is the ankle brachial index. So for the ankle brachial index, we are going to compare blood pressure in the ankle and then blood pressure on the arm. So if there is a decrease in blood pressure in the one at the ankle, then we can conclude that this is peripheral artery disease. Another diagnostic tool is going to be a Doppler ultrasound. So these are the diagnostic tools used in diagnosing peripheral artery disease. And to our treatment, we are going to give statins and then antiplatelets. And then other treatment that can be done, we can do surgery for them. So an angioplasty to restore blood flow. We can also do a peripheral bypass graft for them. And to our education or our nursing management, we are going to educate the patient that whenever they feel pain whilst walking, that is during the intermittent claudication, they should take a stop or they should take a rest for a while till the pain subsides, and then they continue when they are okay or they feel better. We will also educate the patient to avoid crossing the legs, which is going to restrict blood flow. We are also going to educate them to avoid restrictive clothing. Okay, they should avoid tight clothing because that can also impede blood flow to the legs. And then they should maintain a warm environment. Cold is going to constrict the vessels. We want the vessels dilated so that more blood can be shifted to the extremities. So they should avoid cold. And then they can also be educated to avoid nicotine and caffeine. The reason is that all these substances are vasoconstrictors, and we want to avoid any other thing that is going to constrict their vessels. So these are the things we are going to educate the patient on. All right. We will also educate the patient to inspect their feet daily for cuts, blisters, redness, and swelling. We will educate the patient to also trim their nails straight across and wear comfortable, well-fitting shoes. We will also educate the patient to take their medications as prescribed. Alright, thank you and see you in our next video.